Hi guys, I'm Sarah from Somatic Movement Center. Today I want to talk about scoliosis because it's a condition that can be helped quite a bit with clinical somatics. So scoliosis is a lateral curvature or side bending of the spine. If the spine is bending to one side, it's called a C-curve, and if the spine is bending to both sides, it's called an S-curve. Typically, if the degree of curvature is more than 10 degrees, it will be diagnosed as scoliosis. Now, there are different causes of scoliosis. Some cases are congenital, which means that the scoliosis is a structural abnormality that's present at birth. Other cases are classified as neuromuscular. In these cases, the scoliosis is caused by a neurological or muscular disease like cerebral palsy, spinal cord trauma, muscular dystrophy, spinal muscular atrophy, spina bifida, neurofibromatosis, or Marfan syndrome. The last major classification is idiopathic. This term means that the cause of the condition is unknown. About 80% of all scoliosis cases are classified as idiopathic. So 80% of the people who get diagnosed with scoliosis don't even get an explanation as to what has caused it. In my opinion, many of the cases classified as idiopathic are either caused or made worse by tight muscles pulling the spine out of alignment. If you've watched any of my other videos, you might have heard me say that our bones don't move unless our muscles make them move. So unless you have a structural issue with your vertebrae, it's most likely that you have tight muscles that are pulling your spine out of alignment. If you have scoliosis, you can probably reach around and touch your back and feel those tight muscles. And you might be feeling soreness and pain because the muscles are so tight. So why are your muscles tight? Well, everyone has some chronic involuntary muscle tension somewhere in their body, sometimes in many parts of their body. It just so happens that your tight muscles are in your back, probably in your sides, and maybe in your chest and abdomen too, and they're pulling your spine out of alignment. Actually, a lot of people have tight muscles that pull their spine out of alignment, but the degree of their curvature is less than 10 degrees, so they don't get diagnosed with scoliosis. But they may have pain and other issues because of their small degree of curvature. So we all build up some involuntary muscle tension over the course of our lives because of the natural motor learning process of developing muscle memory. When we repeat certain postures or movements over and over, or if we have a protective reaction to an injury, our nervous system learns to keep certain muscles tight, and we lose the ability to voluntarily relax them. So you may have developed this involuntary muscle contraction because of an injury, or because of a repetitive activity, or because of emotional or physical stress. It's completely normal for your nervous system to react in this way. And there are two things I want you to understand. One, you are capable of retraining your nervous system and regaining control over muscles that are involuntarily contracted. And two, we build up more and more muscle tension as we age, so the earlier you start retraining your nervous system, the better. There's some impressive research actually that shows how rates of scoliosis go up as we age. Between 2 and 5% of teenagers are diagnosed with scoliosis. By age 40, that percentage goes up to 8%. Then by the time we get to age 60, somewhere between 35 and 68% of adults meet the criteria for scoliosis. That's a huge increase, and it's a strong indicator that our habitual muscular patterns, which get more pronounced as we age, play a role in developing scoliosis. Now, some people might argue that disc degeneration contributes to the increased rate of scoliosis among people over 60. Our discs do naturally get thinner and weaker as we age. But this thinning of the discs just decreases the padding in between our vertebrae and makes us a little shorter. It doesn't make us bend to the side, so scoliosis really is a different issue. Okay, so let's talk about treatments for scoliosis. Like I've said before, the bones in our body do not move unless our muscles move them, and our muscles are controlled by our nervous system. Manual lengthening, like massage and stretching, and forced realignment, like bracing and chiropractic, are not effective ways to retrain the nervous system. In order to retrain the nervous system and change the messages that it's sending to the muscles, you need to engage the nervous system in an active learning process. That means doing slow, conscious movements that teach the nervous system how to release involuntary muscle contraction. In clinical somatics, we use a movement technique called pandiculation that releases involuntary muscle contraction and brings muscles back into voluntary control. Pandiculation resets the alpha-gamma loop, a feedback loop in the nervous system that controls the resting level of muscle tension. Pandiculation is very gentle, and it's also very relaxing because it releases your tight muscles. Now, everyone is different, but what I've observed in the people I've worked with who have idiopathic scoliosis is that their muscular pain tends to improve quickly with clinical somatics, and their spine gradually straightens over time. Your spine can't become perfectly straight overnight. It's just not possible. It takes time for your nervous system and your muscles, tendons, and ligaments to adapt to a new posture. Your scoliosis has probably been developing for many years, so it may take years for your spine to fully straighten. The most important thing is that you're heading in the right direction, that you're working with your scoliosis in a constructive way so that it improves instead of gets worse. So you can learn clinical somatics exercises from a certified practitioner, either in private sessions, group classes, or on your own at home. If you want to learn more and start learning exercises at home, go to somaticmovementcenter.com.